What is intermittent fasting?
Intermittent fasting involves cycling between periods of eating and fasting. Rather than focusing on what you eat, it emphasizes when you eat. Common approaches include the 16-8 method, which means fasting for 16 hours and eating during an 8-hour window. It's gained popularity for its simplicity and promising health outcomes supported by various studies.
Weight management and fat loss.
Research suggests that intermittent fasting can aid in weight loss and reduce body fat. The fasting period decreases calorie intake and helps the body switch to burning stored fat for energy. This approach may also help reduce belly fat, which is linked to increased health risks. These effects often occur without the need to count calories.
Improve metabolic health.
Intermittent fasting may enhance metabolic health by improving blood sugar control and insulin sensitivity. Studies have shown that fasting can lower fasting blood glucose and insulin levels, which are key factors in reducing the risk of type 2 diabetes. It can also help maintain healthy cholesterol and triglyceride levels, supporting overall cardiovascular health.
Supporting cellular repair.
During fasting, cells initiate important repair processes, including autophagy, where old or damaged cells are broken down and recycled. This process is associated with protection against various diseases and the maintenance of healthy cellular function. Enhanced autophagy is thought to contribute to longevity and resilience against age-related conditions.
Brain health and longevity.
Intermittent fasting may benefit brain health by reducing inflammation, supporting new neuron growth, and improving cognitive function. Some animal and human studies suggest these fasting patterns could lower the risk of neurodegenerative diseases. While more research is needed, early evidence points to a potential increase in both lifespan and quality of life.
Starting intermittent fasting safely.
If you're considering intermittent fasting, start gradually and pay attention to your body's signals. While many people find it safe and manageable, it's important to consult with a healthcare provider, especially if you have any medical conditions or take medications. Pairing fasting with a balanced diet, adequate hydration, and restful sleep supports the best results.